Hi, Victoria.
How you doing?
Hi, I'm Dr. Song with the
Hi.
anesthesia department.
Anesthesiologists meet with patients prior to any surgical procedure. An anesthesiologist will meet with you and evaluate your medical condition and create an anesthetic plan that is right for you. Anesthesia care for obese patients presents special challenges. Even simple vital sign monitoring, which is essential and life-preserving for all patients, can be a challenge when the patient is significantly overweight.
There are serious risks for obese patients who undergo anesthesia. When a patient is overweight, they will take longer to wake up from anesthesia. They have a higher risk of blood clots, respiratory failure, and operating room bed positioning injuries. Even obtaining an accurate blood pressure measurement is difficult because most blood pressure cuffs will not properly fit an obese patient. It's also hard to introduce intravenous lines in obese patients because it's simply difficult to find the vein. Pain control is also, unfortunately, more challenging to control in obese patients.
A patient is considered obese if his or her body mass index is greater than 30. Body mass index, or BMI, is a measure of body fat based on the height and weight of the patient. Illnesses associated with obesity, such as type 2 diabetes, obstructive sleep apnea, hypertension, and cardiovascular disease, can have serious implications for patients requiring surgery and anesthesia.
In the operating room, placing an airway tube such as this one and helping patients breathe can be quite challenging. In addition, obese patients may have sleep apnea, which means that there's an obstruction between their windpipe and their mouth, making it difficult to breathe while sleeping. This condition becomes more exaggerated with general anesthesia. It can also be quite challenging to place a breathing tube known as an endotracheal tube because of the excessive soft tissue in the mouth and in the throat. Patients with sleep apnea may not be good candidates for some outpatient surgeries and may require overnight stay to monitor their breathing. Anesthesiologists such as myself anticipate these difficulties and prepare for them and counsel patients regarding potential complications.
Obese patients who are scheduled for surgery should discuss their condition and their options with their physician. Obese patients can be assured that their anesthesiologist is highly skilled to manage their condition and deliver a safe and pleasant anesthesia experience. Patients who are considering a weight loss program prior to surgery should discuss it with their physician first to ensure it will not interfere with the course of procedure. For more information on preparing for surgery as an obese patient, please visit lifeline2modernmedicine.com.